Here and
Okay.
all right, we are live. So welcome everybody back to another PCBH Corner. I'm super pumped, as I am for most of these PCBH Corners, but particularly that we have Larry Mauksch that's gracefully joined us today and donating some time. So I really appreciate it. Larry. You know, I don't think you need an introduction. I don't think I think everybody probably knows who you are, but if you would like to give an introduction, maybe about what your role is currently, any past things you want to highlight, I'll give you some time to introduce yourself here.
Oh, well, my role currently is I'm, for the most part, retired. I still have my hands in a few projects. But by way of introduction, I started working in what was called collaborative care or collaborative practice. Back in 1982, I joined a couple of docs in the Ballard area of Seattle, and I worked with them for 3 years, and then joined the faculty of the University of Washington as the behavioral scientist. And I worked at the residency and in the medical school from 1985 through 2015. And during that time, I expanded my work to be beyond working as a teacher and a clinician to doing research and writing and becoming very involved with Collaborative Family Healthcare Association, helping start it up actually, and I feel very grateful. I've had a very rewarding career and have had the opportunity to work with just so many wonderful people in the field.
You know, and Larry, again, thank you for just for being here today. You know, I don't know for people that are watching if they've had the great opportunity to just spend some time with Larry, to talk with them. I know this is corny as hell to say, but you're one of my favorite people to talk to. So it just is. I really appreciate this today. So, you know, the first thing, and I think this is one of the benefits of doing some of these PCBH Corners is that we get to hear what got people into like integrated care, kind of like people's history. And I will say, I've been so surprised, and again, even the last one that we just did with Sandy, about how many accidents there were that just got people into integrated care. So are you okay sharing kind of your history of like, what got you into integrated care and how did that come about?
Well, I don't know if it was an accident or not. I actually come from a family. I was thinking about this. I come from a family with a mother who was a nurse practitioner and a father who was a medical sociologist. And I became a family therapist. And pretty early on, even before I graduated from college, it was obvious to me that I was interested in the intersection between medical and behavioral health. And when I finished graduate school, I set out to find medical practices where I could join them. And I went around the greater Seattle area and met a variety of different people and talked with them, pediatric offices and hospitals and primary care clinics. And I settled on one family medicine clinic where they invited me to join them. And it turned out to be 3 of the most rewarding educational years, professional years of my life. It was a small 2-person family medicine practice in the Ballard area of Seattle, where they shared their patients with me in their office space and their office function. And we shared notes and we talked about patients together all the time. And it was an incredible experience where I learned so much medical vocabulary and so much about the world of primary care and so much about what it means to be a primary care practitioner. And that's where I started for 3 years. And then I was invited to apply for the position at the University of Washington. One of the guys I was working with, one of the family doctors, was Bill Phillips, who was a part-time faculty at UW. He's a major person in the field. He was one of the founders actually of the Annals of Family Medicine and became one of the endowed chairs in our department. And he's always been a close friend and mentor and encouraged me to apply for the job at the university, where I then spent the rest of my career.
You know what's interesting about it, Larry? I think besides Chris Hunter, I think you and Chris are the only two people I've talked to that said almost from like the beginnings, like this was where you were going. This was, now, the one thing that I am curious about, and really interested, you know, as you said, having your family kind of background, and then you went into family therapy. Did anything draw you to family therapy? Like, what was it about family therapy that like really sucked you in?
Well, it's fundamentally it's the systems thinking. So, and not coincidentally, I mean that's the foundation of family medicine, right? Systems thinking, and so you know, it's always been apparent to me that there is a very rich interplay between biomedical and psychological and social function in understanding health, and to separate those healthcare efforts is very inefficient and possibly harmful. And intuitively, I think I understood that for a long time, and was excited to see opportunities to actually put the interplay of all of those kind of clinical services into actual applied clinical design.
It's fantastic, you know, and obviously with our talks before about, you know, systems or contextualism and stuff, it is just such a neat field to be in. And to see, as you say, all these different interplays, not only just with like patient systems and patient context, but literally like health systems and how those things interplay. That's neat. That's neat. Okay.
It is. Well, and you're doing some very exciting things in Yakima. I really enjoy watching what you guys are doing.
Well, thanks, Larry. We love, and I will say this to our viewers, Larry, I don't know if you want me to say this, but I'm going to say it anyway. You know, Larry maybe is one of the most giving people I've ever met. That he comes to Yakima usually once a year and talks with our interns and our fellows. So my mind is just saying, reach out to Larry, like one of the most responsive individuals that's out there. Again, I don't know if Larry wants me to say that, but I'm going to say it anyway. One of the most responsive individuals. So it's really been great. Now, you know, speaking of which, as you were saying about your role at UW, and